If you are a woman with gut issues, then this episode is for you. I'm Deleanne, you're watching Natural Medicine World, and we're filming from Cape Town, South Africa. In a previous episode, we asked Dr. David Nye what could possibly be a natural solution for gut-related issues. And he suggested a herbal remedy made from various different extracts in tincture form. Now, Progast is such a remedy. And I asked the CEO from Tara Pharmaceuticals, Paul Bosman, if he would be up for a challenge in showing us a before and after film interview with a patient taking Progast drops. And Paul's exact reply was, why not? Let's go back. These are real people, Dr. David Nye, and let's meet the patient, Maya.
I see from your questionnaire that you have a lot of issues with your gut and with sinuses. So I wonder if you could tell me a bit more about them, how long they've been bothering you, what symptoms you have, and let's see what we can do to help you.
Look, it's been years and years that I've had a problem with my stomach, probably even since my teenage years. I've always just found that my stomach gets unhappy with things. Stress can often be a trigger. But recently, the reason I'm here is that it's got really worse. I picked up a bit of a virus, and since then, my stomach is just really not settling down again. But generally with my gut, it's bloating. I get terrible bloating, especially after eating and an evening meal. So sometimes I'll go out for dinner and I'll actually walk out like I'm 6 months pregnant. And it's that awful bloating and the pain that's associated with it. So probably the best way to describe it is I feel like sometimes I'm eating glass and I'm trying to digest glass. It's just such a sharp pain.
Sounds very uncomfortable.
Yeah, it is really uncomfortable. And then obviously it's difficult to sleep and yeah, it's just really unpleasant.
Okay, have you noticed any particular foods that affect your gut and how they affect your gut?
Well, definitely the bread. So cutting out all bread has made a big difference.
Okay, good.
But I kind of sometimes feel that it's anything I eat. And, I've been trying to work out what it is. So sometimes I think it's nuts. If I'm eating nuts, I wonder also sometimes seeds, things that have high roughage. I think that could be triggering it. Then I worry things like cabbage maybe that are creating the bloating. So it's actually quite difficult. And sometimes I'll eat a meal that I think has got nothing in it that could trigger me and I'll still have a sore stomach afterwards.
Yeah, it can be very confusing and sometimes very difficult to pinpoint what foods might be triggering it, because the problem with food intolerances is that they are not like an allergy which can react quickly. They often have a delayed effect. So you might have something that you've eaten on a Monday and it only causes a reaction on a Wednesday. And that's then very difficult to tie in. And so this is why it can be very difficult to determine just by process of elimination what foods might be problematic. And so with a simple blood test, we can test 220 different foods, and this will give us some good guidance as to what foods you need to eliminate from your diet. What we also need to do, obviously, we need to do a physical examination. You've had a colonoscopy done already, so we don't need to do that again. We might do some blood tests. We like to test your vitamin D level because vitamin D3 is very important for protecting the gut. And the other test that we would like to do is a stool flora analysis, whereby we can analyze the concentration of probiotics versus unwanted bacteria in the gut to see whether you have any deficiencies or otherwise of the good probiotics, and to see whether there's any overgrowth of unwanted bacteria or yeast or candida or things like that. And with that information, we can then set about correcting that. And then we're going to, once we've got the results back, we're going to put all that together into a leaky gut treatment protocol to really try and correct the gut microbiome, the leaky gut nature of it, all of which is leading to your irritable bowel syndrome symptoms and leading to your sinus symptoms. In the meantime, I'm going to give you some herbal drops, which has got a combination of different herbs in it. Some of those herbs are really good for, there's like ginger in there, which is very good soothing for the stomach. There's slippery elm, which is also very good for lining or soothing the lining of the gut. It's got licorice, it's got melissa, it's got several other good herbs in there. And these are all going to have an effect on dealing with the symptoms that you're complaining of. It's in a tincture form, which means it is very well absorbed. So it's not like a capsule, it's got to dissolve first, so the tincture will get absorbed very quickly. And you just take 20 drops 3 times a day. It's as easy as that. and that should give you some good relief until we get the results of your test back.
Great.
If you're interested to see where Progast is manufactured, come with me.
Good day, my name is Paul Bosman. I'm the responsible pharmacist and managing director from Tara Pharmaceuticals. I'm happy to say that the product Progast is manufactured at a GMP facility, Afriplex, under the leadership of the responsible pharmacist, Robert Longrig.
Hi, I'm Robert Longrig. I'm the responsible pharmacist at Afriplex, and we are proud to be associated with Tara Pharmaceuticals, an ethical marketing company producing a product for them called Progast.
Let's ask Robert how a tincture is made.
It is macerated for 5 days in ethanol. It's a very critical process. It's a 1 to 10 dilution, plant to extract ratio. And once that is done, we then press the product, and we then have a intermediate tincture. To get that now into your product, we then have to further concentrate it using a process of evaporation. We remove all the ethanol off, and we get a highly concentrated tincture, and then we then reconstitute it back up to the 25% ethanol for the preserving ability of your product, which is important for stability reasons and also for safety in terms of ethanol and for usage in children.
I'm very happy that Progast can be manufactured at Afriplex, a high quality product that will be stable, consistent from batch to batch, and effective. So patients that get it out there will know from each product and each batch they will have the same product every time. Okay, so that's where the quality comes in.
The quality, we start already from the raw material side. All the raw materials are tested when they arrive. We have vast array of equipment to test the products. We use FDRR, which is an infrared scanning process. We use thin layer chromatography to prove that the plants are consistent. Once that is then done, we can release the raw materials for manufacture. And when the product is manufactured, it gets once again goes through to quality control for testing. We then test the final product for to make sure that the actives are inside. We then also look at the ethanol content for the label claim. We test that, and we put the product onto microbiological testing to make sure that there is no bacterial growth in the product. Once that's all done, then we can release the product, and we issue you with a certificate of analysis and a release to market.
Welcome back. We've got the results of the test back, but first of all I'd like to find out how you've been doing on the herbal drops that I gave you. You were complaining of quite a few symptoms, and I would like to know how the drops have helped, whether they've changed anything, whether anything's worse or better. If you could just tell me what's happened with the drops.
The drops have made quite a significant difference. I
Oh,
can't
good.
say I'm completely cured, but they definitely help settle my stomach. So
Right.
I find that when I'm getting that, remember I described that glass, sort of swallowing of glass feeling,
Yeah.
that really helps. It reminds me to go take the drops. And
Yeah.
I kind of feel like it's almost a warmth that goes through into my gut and sort of feels like it's all just settling and calming it down. So I suppose in my head, psychologically, I sort of think of this inflamed stomach that kind of just starts to perhaps be a little less inflamed, a little bit more settled.
That
So
sounds
it's
good.
definitely helps. And that's what you need. You need something just to alleviate
Sure,
when you're in that pain.
What about the bloating? Has it helped with that?
Yes, I think it has helped as with the bloating. I suppose my main concern is always the pain. So when I take it and I just have that warming feeling, that definitely helps. I know I'm supposed to take it 3 times a day, and I do forget. I'm very bad at remembering
It's
things.
human
but,
nature. Yeah.
but so that's why I'm saying the pain, it's a good reminder. And then I think, let me go and take those drops, and I do. It definitely makes a difference.
Right, good. What about the cramping? I think you complained of cramping as well, or not really?
No, not really. I mean, when I
No.
had the virus, the cramping was a problem, but not so much now. It's more that feeling of, it's the bloating and that feeling of digesting glass, I suppose. It's my best explanation.
Has it affected your regularity at all?
Possibly. I have been, definitely have been more regular. So I hadn't put that 2 and 2 together, but yes, possibly has as well.
Good. So it looks like it ticks quite a few boxes.
It does, yeah.
Good. So we've got your results back, and the food intolerance test, where we tested 220 foods to see which foods are inflammatory or you're intolerant to. And top of the list is cow's milk, which I think you weren't surprised about.
No, yeah.
You suspected that already. Unfortunately, sheep's milk and goat's milk and almond milk as alternatives would also be excluded. But eggs and one or two other things are also on the list. So this is a list that you need to go through in detail. You need to avoid those foods for a period of time, and while we're working on the rest of the gut. We'll find that once we've done the leaky gut protocol, which takes you about 4 to 6 to 8 weeks to do, you should be able to reintroduce some of these foods one by one, and you might well find that quite a lot of these foods can be reintroduced quite happily. Some of the foods might need to be avoided for a much longer period of time. So the other test that we did was your stool flora analysis. We've got that back, and that shows that your probiotic levels are quite reduced. So we need to boost up your probiotic levels. This gives us 3 specific ones to work on. And it also shows 3 overgrowths of different bacteria. These are not pathological bacteria in the sense that they're going to cause illness, but they're causing an imbalance. And so it's important that we address that. We try and get rid of those bacteria so that we can reach an equilibrium again. And the last thing that we find is that you have a candida overgrowth as well. This can certainly be problematic, and we need to eliminate that as well. So by boosting up your probiotics and getting rid of the bacteria and the candida, we can certainly do a lot in helping the gut microbiome to recover.
So to conclude, for any gut-related symptom relief, there's definite benefits in trying ProGast.